Well, hello, everybody. Good morning or good afternoon, depending on where you are in the country. My name is Garrett Schmidt, and I'm the CEO and managing editor of VBC Exhibit Hall. And I'd like to welcome you all to today's live webinar hosted by WellSky, and it is called Elara's Caring Innovative Approach to Improving Patient Care Coordination. Very excited to hear from our speakers today, who I'll introduce momentarily. But a few items of note before we get started. This is a traditional webinar format, so everyone has joined today in listen-only mode, so you don't need to worry about turning off your microphone or your camera. We can't see you or hear you. But as I always say, we do want to hear from you, and so we're going to have a time for some Q&A towards the end of the presentation. So if you have a question for either of our speakers at any time during the presentation, you can ask that question using your control module. There's a little space specifically for questions. So you can drop your question in there. We're going to get to as many as we can. Again, we have a big audience and a lot to cover today. So if we don't get to your question, though, don't worry. Someone will reach out to you via email to make sure that we get your question answered after the presentation. The session is being recorded today, so what's going to happen is when we conclude, I would say about an hour or so afterwards, you'll receive an email, and that email will have a link to today's recording as well as to where you can download the slides. And that way you can review it at your leisure and or share it with colleagues and friends, and we hope that you do, so there will be a shareable link that you can use. All right, well, without further ado, again, I know we've got a lot to cover today. I'm going to introduce Miss Leah Goldman, and she is a senior marketing strategist with WellSky, and she will introduce our main speaker today. So welcome, Leah.
Great, thanks, Garrett. Hi, everyone. I'm very excited to introduce you all to today's speaker, Kayla Power. If we could go to the next slide. Great. So Kayla is an experienced healthcare leader specializing in patient care coordination for home-based services. As the Director of Patient Care Coordination at Elara Caring, she plays a pivotal role in driving growth across various programs, including skilled home health, hospice, personal care, and behavioral health. Her leadership extends to ElaraConnect, where she focuses on enhancing operational efficiency and optimizing care coordination. With over 10 years in the field, Kayla has held key leadership roles such as Regional Administrator and Director of Clinical Services, where she successfully developed new programs and has implemented quality improvement initiatives. Her broad expertise in program development and healthcare operations positions her as a strategic leader in advancing patient-centered care. And before handing it over to Kayla, I will quickly go over our agenda. So during today's session, Kayla will guide us through key aspects of Elara Caring's approach to improving patient care coordination. She'll start with an overview of the organization, and then she'll dive into how Elara Caring has enhanced care coordination across various agencies. Kayla will explore strategies for operationalizing workflows using real-time alerts, and then how leveraging insights can lead to data-driven decision-making. And then she'll go into how the future opportunities with Elara Caring and their technology that they're using. And then finally, we'll wrap up with a Q&A session that Garrett mentioned at the beginning. And then before we do get started, I'll turn it quickly back to Garrett to launch a poll for you all. We've done this a few times in the past, and we'd love to hear from you. So we will launch the poll, and then you'll be able to select some options.
All right, so if you're playing along at home, you will see this pop up on your screen. This is anonymous, by the way, but this is just kind of for fun, and so you'll get a chance also to, because we'll show the results, and you can kind of see who all is on the call today. And what type of organization do you work for? Is it a hospital or health system? Is it a payer, an ACO organization, post-acute care, or other? And if it's something other than that we haven't listed, we'd love to hear what that is if you want to drop that in the chat. And we'll wait on the results to come in. Give it maybe another 10 seconds. Okay, looks like the results have slowed down coming in, so most people have selected. So I'm going to go ahead and close it down in 5, 4, 3, 2, 1. All right. Kayla and Leah, are you able to see who's with us today?
I do. It looks like we have a pretty good mix of hospitals and health systems, post-acute care organizations, and quite a bit of other as well. So that's great. The session is going to be valuable for all levels of care as we dive into how Elara Caring is collaborating across the continuum.
All right, back to you.
All right, if we can move to the next slide. Thank you, Garrett and Leah, for the introduction. I'm excited to introduce Elara Caring, and I hope you take something away from the webinar today. Let's get started. Elara Caring is one of the nation's largest providers of home-based care, with a footprint spanning 18 states in the Northeast, Midwest, and Southwest. With over 26,000 caregivers and more than 200 locations, we were founded in 2018 when we brought together award-winning organizations to deliver exceptional, personalized care wherever patients call home. We proudly serve over 60,000 patients and their families every day. Our comprehensive services include skilled home health care, hospice care, personal care services, behavioral health services, and palliative care. These programs are all tailored to meet the unique needs of each patient that we serve. At Elara Caring, we believe in delivering the right care at the right time and in the right place. Our commitment to innovation, compassion, and collaboration drives us to make a meaningful difference in the lives of those we serve. I'm now excited to start discussing some of the WellSky solutions that we utilize day to day. We were already using the WellSky CarePort intake and WellSky CarePort referral management solution to connect with hospital partners and manage referrals. To enhance care coordination, we decided to expand our partnership to include CarePort Connect. We leverage these referral solutions across our enterprise to automate the entire process of creating, receiving, and managing referrals. This automation reduces manual tasks such as phone calls and faxes, saving our staff valuable time and allowing them to focus more on patient care. We've seen improved communication and electronic information sharing between referring providers, such as hospitals, and receiving providers like skilled nursing facilities and home health agencies. This ensures that all parties have the necessary information to provide the best possible care to all patients. Additionally, the system's robust reporting tools analyze referral patterns, identify trends, and monitor key performance indicators, supporting data-driven decision-making and improving overall care coordination for our agencies. With WellSky Solutions, we have access to an expanded network of providers across the continuum, facilitating seamless and more effective patient care transitions. We also leverage the patient matching tools to help case managers and patients identify the most appropriate care setting based upon patients' needs, preferences, and quality metrics. While CarePort referral solutions help us receive and manage patient referrals, we really needed a solution that allowed us to know when and where our patients were outside of our care. We then implemented CarePort Connect. This was to get a holistic view of the patient's journey across different care settings. We can see the complete picture of a patient's care history, which helps in making informed decisions over the past few years. my team has operationalized CarePort Connect within Elara Caring. I'm going to mention that later on in the session. Right now, I'm going to dive into some of the other challenges that we faced prior to implementing that solution. So you may ask why we were looking for a solution to start with. As an enterprise, we encountered challenges due to the absence of real-time alerts and notifications, which hindered our ability to maintain visibility into our patients. This lack of timely data created significant challenges in patient care, and we were not aware of patient readmissions. Without immediate information about patient readmissions to the hospital or emergency department, continuity of care was disrupted, and that prevented us from proactively intervening, which are two key elements of effective care delivery. Without instant clinical event alerts across different providers, we faced communication gaps that slowed down critical responses and coordination efforts for our teams. Those delays had a direct impact on the quality of care our patients were receiving. Finally, we had missed opportunities for patient engagement. When our outreach to patients is delayed or incomplete, it interrupts care transitions, negatively affecting patient outcomes as well as overall satisfaction. Timely and consistent communication is essential for ensuring a smooth and effective care experience. By addressing these gaps with better data and intelligent tools, we have been able to significantly improve care coordination as well as patient outcomes. We can move to the next slide. Perfect, thank you. However, implementing new technology did not solve all of our problems. We still faced operational barriers internally. We have overcome a lot of these challenges, which has enabled us to successfully operationalize CarePort Connect within our team. I'm going to go through a few things that we did to get over these barriers. As you all know, for any new system or tool, ensuring that staff are properly trained and comfortable using the system is critical. Resistance to change, limited time for training, and the struggle to ensure consistent adoption across teams are all barriers that we had to address. The key is making training accessible, engaging, and ongoing so that adoption became second nature. Next were communication gaps. We had misalignment between teams, which can significantly hinder coordination and patient care. One example that we have encountered involves facility case managers that we collaborate with on patient care, not understanding that they were sharing data through CarePort Connect. We needed to explain why we were reaching out about patients in their facilities. By providing clear and effective communication processes and tools, we've been able to educate all parties on how the system works to help bridge those gaps. Now on to geographical limitations. As you all know, serving patients in remote or underserved areas brings its own logistical challenges, like connectivity issues, limited access to resources, and extended travel times for staff. We face challenges in getting timely data to clinicians in some of our rural markets. These hurdles really highlighted the need for an adaptable solution within those markets so that we can minimize delays and still ensure care reached every patient. Lastly, we faced resource allocation challenges. Distributing staff, equipment, and time across multiple locations and patients can be difficult, especially when demands fluctuate or resources are stretched. To overcome this, we utilize the alert data from CarePort Connect to prioritize needs and allocate our resources appropriately, still ensuring that we maintain high quality care to every patient we serve. Across all of these areas, the power of data was clear. It gave us the insights we need to drive smarter decisions, improve efficiency, and ultimately provide better outcomes for our patients. Next, I want to spend some time discussing how we improved care coordination across our agencies. Let's start with why we decided to partner with WellSky. To enhance our care coordination, we had identified a need to expand visibility into our varying markets. And ElaraConnect and ADT feeds enabled us to do just that. Shown here is a graph of the WellSky expanded network, which has given us access to incredible volumes of data. That leads me to the real-time alerts that we are receiving. These have been a game changer for us, enabling faster patient outreach and more streamlined coordination across teams. Immediate notifications allow us to act quickly and address patient needs without unnecessary delays. This responsiveness is critical in delivering timely and effective care. By having this data, we've been able to see that the average SHP risk score is about 3.9 for the patients that we're actively receiving data from. In addition, having improved visibility to patient encounters, like knowing when patients are discharged or transferred, has provided us the ability to proactively plan follow-up care for smoother care transitions. Also, by obtaining the diagnosis information in real time from the solution, we're able to adjust our plan of care for patients to prevent future readmissions more effectively and timely. That allows us to monitor our high-risk population closer in order to keep patients safe at home. At Elara Caring, this approach directly enhances patient outcomes and strengthens continuity of care. Real-time data and visibility empowers us to operate efficiently, deliver better patient care, and make a meaningful difference in the lives of our patients. All right, so let's move on to some strategies that we have put in place to operationalize workflows with the data. At Elara Caring, our patients are at the center of what we do every day. By having a comprehensive solution at our fingertips, we can gain a better picture of ways that we can improve the care we provide. Also, by leveraging accurate real-time information, we can make better decisions and truly optimize the way we work. Let me give you an example. When looking at home visits, we can know a patient's status in real time to allow us to pause or resume visits when it's appropriate, ensuring that our resources are best allocated and patients get the care they need at the right moment. This level of data-driven insight eliminates guesswork and helps us prioritize effectively. This aligns with the value-based purchasing measure by reducing hospitalizations and improving functional outcomes. This also shows patients were responsive, boosting HCAHPS scores. Early outreach to patients is another powerful example. When we can identify issues sooner, we're able to engage with patients earlier, reducing delays in care transitions and improving overall outcomes. This proactive approach ensures we support timely care, building trust with the patients, and improving our communication scores. There's also smarter resource allocation. By using data to identify trends and needs, we can better distribute staff and time across patients and multiple locations. Ultimately, this lowers our costs, ensuring high acuity patients get priority, and allows us to support discharge to community for our patients. Finally, let's talk about workless. With data guiding us, we can develop structured work lists that drive our daily workflows. These lists don't just keep us organized. They ensure that we're meeting patients' needs in a strategic, efficient way. Streamlining tasks ensures timely care and better wound healing for patients. Organized visits improve care coordination and reduce emergency department usage. For patients that do have that high emergency department usage, this allows us to evaluate the patient's support system at home and also collaborate with the patient's primary care provider in order to adjust our care plan to enable the patient to stay safe at home. These strategies are all powered by the data, which empowers us to make more informed choices, streamline our processes, and deliver exceptional care to every patient we serve. Let's move on to how we leverage insights for data-driven decision-making. Perfect. Again, at Elara Caring, data is at the core of how we improve care and efficiency. One way that we do this is by tracking patient encounters and analyzing our alert volumes. By categorizing our encounters, we're able to monitor care transitions in a structured way and identify meaningful trends. This insight helps us understand where adjustments are needed to streamline processes and enhance outcomes. Prioritizing patients is another critical focus. With alert-based attributions, we can act quickly and effectively. This allows us to ensure that the patients who need attention the most are addressed without delays, optimizing both care and resource use. Finally, the power of data enables us to refine processes continuously and elevate the quality of care we provide. Whether it's identifying bottlenecks, improving workflows, or enhancing patient satisfaction, data-driven insights helps to guide that decision. At Elara Caring, this commitment to leveraging data ensures that we not only meet patients' needs, but we exceed their expectations. This graph shown here provides valuable insights into the fluctuations in event counts that we see and helps us understand our overall activity levels. The graph that you do see on your screen displays data from the last 12 weeks. The overall total events as of March 30th was 134,000. This figure represents the cumulative activity over that specified period. The blue area under the line graph visually represents the event counts over time, highlighting the fluctuations in weekly activity levels. In conclusion, this graph provides us a comprehensive view of the weekly activity trends for events through CarePort Connect. By analyzing these fluctuations, we can gain insights into the factors influencing event counts and make informed decisions to optimize our strategies moving forward. Okay. Lastly, I do want to share a bit about some future opportunities for Elara Caring. As an enterprise, we are continuously evolving to enhance patient care as well as operational efficiencies. The organization is focusing on leveraging the advanced technology we use to further improve care coordination and patient outcomes. This includes expanding the use of real-time data and analytics to refine processes, prioritize patient needs, and streamline our workflows. Additionally, Elara Caring is committed to strengthening collaboration across the care continuum by integrating more robust tools for communication as well as data sharing. These efforts aim to ensure seamless transitions of care and proactive patient engagements. Before we conclude the webinar, I'd like to give everyone the opportunity to let us know where your organization is in adapting technology to track patients and collaborate across the care continuum.
All right, we've got another polling question here, and you will see that on your screen. And if you're just joining us, these are anonymous. And the question is, where is your organization in adopting technology to track patients and collaborate across the continuum? Kayla, I like how you said care continuum. I think that's awesome. Not considering it yet, interested but not ready, exploring the idea, actively researching and need more information, or already using a solution and hopefully happy with it. But if not, maybe you're in the exploring phase too. And we'll show the results here in a minute, and that way you can kind of see where you stack among your colleagues here. So we'll give it about another 10 seconds, and then we will show you the results. Where is your organization in adopting technology to track patients and collaborate across the continuum? Okay, so I think most of the results have come in, so I'm going to go ahead and shut it down in 5 seconds. 4, 3, 2, 1. There's always someone scrambling to do a last minute ad. Here we go. All right, Kayla, are you able to see the results on the screen?
I can, Garrett. So it does look like majority are either using a solution, researching and need more information, or really exploring the idea. So that's great. Okay, now to recap some key takeaways from today's session. First, having the ability to track patient encounters and monitor alert volumes in real time allows us to identify care transition trends and act promptly. This proactive approach enhances patient outcomes by reducing delays and addressing needs efficiently. Next, real-time alerts and categorization of discharges empowers our teams to prioritize patients effectively. By focusing on those requiring urgent care, resources are optimized, ensuring high-impact interventions and overall better care coordination. Lastly, by leveraging data to analyze trends, we can refine workflows and improve overall quality of care. These insights allow us to identify inefficiencies, inform strategic decisions, and uphold a patient-centered approach. I appreciate everyone for taking the time to join this webinar today. I'm now going to hand it back over to Leah to kick off our Q&A.
Awesome. Thank you so much, Kayla. Very insightful. It was great to hear all the success that you're seeing at Elara Caring. So we'll now turn it over to the Q&A. So if you have questions, feel free to put them in the question and answer chat. We did get a few during the session, so we can start with those. So the first one we have is, how was the implementation process for WellSky? What was it like? Were there any challenges?
The implementation process for WellSky was pretty seamless. We did not encounter significant issues during that initial setup. Of course, we have faced and continue to face some challenges post-implementation. Those challenges, like we discussed, are training and adoption from our team members, communication gaps, and misalignment between care providers. While the initial implementation went smoothly, those ongoing issues do highlight the need for continuous support and improvement in those areas.
Great answer. And then another one, how user-friendly is CarePort Connect for your team to use? What's the interface like for your staff?
So the CarePort Connect interface is quite user-friendly for our staff. It has been designed to be intuitive and easy to navigate, which has significantly improved our workflow efficiencies. The real-time actionable data provided by the platform allows our team to coordinate care seamlessly across different settings. However, like any new system, there was an initial learning curve. Some team members face challenges with training and adoption, but with continuous support and practice, they have really become comfortable with that interface. Overall, the user-friendly design of CarePort Connect has facilitated better communication and alignment between care providers, enhancing our ability to deliver timely and coordinated care with all of the providers that we collaborate with.
Great. A few more. So how does WellSky help in managing the patient transition, so from acute to post-acute care?
Great question. So WellSky's CarePort Connect feature enables providers to coordinate care through real-time actionable data. That system helps track and engage active patients across the care continuum, ensuring that transitions are smooth and well coordinated, as well as ensuring that we update our plan of care to better meet the needs of patients. And that also allows us to keep patients safe at home after an event. If we know why they went to the facility in real time, we can really adjust our plan of care to meet the needs better for that patient.
Great. Right, next question. Has WellSky helped in reducing manual processes? I know you kind of talked about this more at the beginning, but maybe you could answer it a little more in depth.
Sure. So WellSky has helped in reducing manual processes and improved our staff's productivity. So by receiving that alert data, we can efficiently realign our field teams to visit patients who are at home and ready to be seen, rather than sending a nurse to a patient's home when we're now getting alerts that say the patient's inpatient. So that capability has streamlined our operations, ensuring that our resources are utilized effectively and our patients receive timely care from us.
Great. This one kind of expands on that question. So how long did it take your staff to fully show those operational efficiencies? If you could share a little insight into that.
Yeah, that's a great question too. So I think that also depends on the teams that we're training. Everyone adapted a little differently to the system. We did have continuous training and made it available to our teams again, so it became second nature. So I do think that it's very important that if you are utilizing a system, that you really put it into your daily practice to help with the adaptation for those efficiencies. For us, I would say it probably took us at least a month of getting the data and seeing the data before our teams were really able to utilize the data in the daily practice. Again, making it readily available, consistent training are all going to help with that as well.
Awesome. Then we have one more question, Kayla. I'm not sure if you can answer it, but I'll ask it if you can't, no worries. Do the alert notifications that you receive in Connect only pertain to Medicare patients? Are there other types of patients as well?
It is actually not only Medicare patients. We do see alerts from several payers within the system, so it is not only specific to Medicare. Great question.
Awesome. All right, well, that concludes our Q&A. If we didn't get to any of your questions, we'll have a WellSky representative reach out for those ones, but I'll now hand it over to Garrett. Thanks, Kayla.
Absolutely, thank you.
Wonderful. Well, thank you, Kayla. Thank you, Leah, for a fantastic presentation. Wanted to encourage you all, as we are closing out here, to head over to bbcexhibithall.com, and you can check out the WellSky virtual exhibit booth and learn more about the CarePort product there, and just kind of read up on them if this is of interest to you at all. You can do some research there, look into it, and of course, contact them through there. There's also in the library at bbcexhibithall.com is where we're going to be archiving the webinar from today. So we are going to be sending out a link to the recording and to the slides. But if you can't find it or want to visit it later, you can find that in the library, as well as a bunch of other resources and things for you on a variety of topics. But as we close out, if you would like to reach out directly to the WellSky team, feel free to do so on this last slide, or to Kayla herself, and or feel free to reach out to me. I'm happy to facilitate an introduction if that is easier. But I wanted to thank you all so much for spending your afternoon with us, and hopefully you will join us for the next one. And so stay tuned. We'll definitely be reaching out to let you know when we're going to have the next one. So thank you all so much for attending. Bye-bye now.